The pandemic has had a profound effect on the way we operate our renal care centres and our protocols and practices. As the pandemic started to emerge early 2020, we got to see what was happening overseas. We got to see how difficult this novel variant or organism is, and how lethal it can be if it's not properly managed. The mortality rate among renal failure patients was 20%, so quite high. So we knew from the beginning we needed to implement a strategy to manage this organism. We didn't have, at that stage, any vaccines. So very early in 2020, we put together a cross-functional team with the expertise to be able to put together or build a pandemic risk management plan which would mitigate the impact of COVID on our patients and our nurses. The objective was to keep our patients and our nursing teams safe from COVID, or as safe as you possibly could make it. In coming together, the pandemic risk management team needed to put together a plan which addressed very fundamental things like vaccines when they came along later. For example, we had over 90% of our nurses and patients double vaccinated before the rest of the country were even at a 40% vaccination level. Also, we had a very strong focus on PPE, personal protective equipment. We knew that that was going to be a cornerstone or paramount to limiting the spread of the infection. Our nurses worked tirelessly in the best of circumstances, but COVID presented extra challenges. They were taking, understandably, longer to do things that they used to do reasonably quickly because they had to don and doff a lot more protective equipment. So it was an increased burden on our nurses, but they're really the heroes of implementation when it came to keeping our patients safe.
We started the screening of the patients really early, so we could avoid that patients with symptoms are dialyzing in our clinical area. And when it was available, we also implemented the QR code for the login. Very important was the start of the vaccination, the early start. Our staff educated our patients about the importance of the vaccination, and now 95% of our patients are double vaccinated or even triple vaccinated.
I've been mitigating the impact of COVID-19 through ensuring that there's communication, collaboration and coordination, not only within our renal care centres, but through the public health system and our local area health departments. So this means that we have educated staff and patients, made sure that the policies and procedures that are being implemented not only through renal care centres and Braun, but through the Department of Health, are followed and implemented as much as possible to ensure the safety of our patients and staff.
I would say it's our resilience that making us go through with this pandemic. The positives that we could take away from this COVID is and how to react on a situation, and that we managed to put in place the protocols that we need to manage COVID. We really worked hard and we understand each other, we work as one. So we had a good teamwork.
I think the COVID has affected my dialysis through being really almost hyper-vigilant about cleanliness, where I go, wearing masks, distancing, social distancing, and being tested. We're tested here twice a week, which I find is wonderful. So it's increased awareness of self-care and care of others. To me, the carers here have responded to the pandemic highly professionally, in a very organised way, and very reassuring to the patients. We've been given briefs of what to do, what's expected. Communication was very clear, and therefore it was just easy to follow what was expected there. It's really accentuated the professionalism of this team here, the commitment, and their initiatives in self-care and caring for us and following the procedures that are set here, taking of the temperature, sanitisation, wearing of masks, all of that's been followed through very professionally here.
Well, I've been suitably impressed. I've actually had dialysis in other facilities, but it was great to come here for a number of reasons, mainly because it's brand new with state-of-the-art equipment, things like continuous monitoring of your blood pressure, well-trained staff, and it's very close to home, so I'm really delighted to be here. The precautions we're taking here is to protect us all, and we obviously got to be careful outside of this facility, but it really has not affected my treatment at all. We've taken all the protocols very seriously, and I think it's kept us all safe.
We're currently in the pandemic phase. Over time, we'll move to the endemic phase. So we'll go pandemic, it'll shift to, which is global, it'll then move to geographical outbreaks, and eventually it'll become endemic into the community over time. So it's always going to be there bubbling away in the background. In terms of managing our renal care centres and keeping our nurses and patients safe, we'll need to continue to observe and implement and monitor the practices we've implemented. Foreseeable future, continue to be very vigilant around encouraging people to be vaccinated and maintaining screening and the PPE we've become accustomed to throughout the pandemic.